Maybe 20, 40 years ago, there were no such equipment, and this test was very important because, for example, patient with cataract, it's a rather simple pathology. For the treatment. The only treatment is to remove the opaque lens and to implant artificial lens. But through this opaque lens, we can't determine situation with the retina, with the optic nerve. Without ultrasound, without other severe equipment, with our modern equipment. We can't see because it's opaque lens, no red reflex, no fundus examination, and so on. And for the prognosis, this test was very important. If your patient has cataract, there will be correct light projection. No vision, but correct light projection of the case. If your patient has wrong light projection, in case of cataract, you can suppose that it's not only a problem of the lens. Maybe a patient has severe problem with his fundus, with his optic nerve and so on. And you can perform surgery, remove cataract, but vision still will be no vision and wrong light projection. Understand the difference, yes? So now this test is not so important, but it's necessary to how to perform it, yes? For example, in our class, during our class work, of course, we just simulate the situation. Let's imagine that our patient has normal vision of the left eye, or subnormal, but very poor vision of the right eye. He can't count my fingers even at distance, several centimeters. It's necessary to check light projection on his right eye. Okay, cover your left eye with a palm by such a way. Position of the lamp opposite the doctor. Must be no light from the source, main source of light, on the surface of the patient's eyes. Because if you put the lamp in this position and begin to show, to put the light from small ophthalmoscope, patient will answer left, 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 because of course this light is stronger. Yes? So you should exclude such a kind of situation. Position of the lamp opposite the doctor. And we use ophthalmoscope. In your practical life, of course, you can use any source of light, maybe pocket source of light, yes, or even sometimes if you have no other equipment, take the lamp, yes, and ask the patient to say, where is the lamp? Up, down, left, right. It's also possible. But during the credit, it must be comfortable, beautiful. Yeah. So we ask the patient to recognize where is the position of light, and we use, of course, concave mirror, and we put the light from different direction. Where is the light now?
Upper left.
No, tell me the truth. Where is it really? Where is the source of light? Up, down, left, right.
From where the light is coming?
Source of light. Where is?
It's easier.
Where is the source of light? Of course,
It's not easy.
He looks like a real person with a wrong light projection. Yes, but okay, it was a simulation, good simulation, good actor, yeah. Okay, so where is the light now? Okay, now.
Up.
Don't forget the only mistake during the credit, if the light will be somewhere but not on the area of pupil, of course. In this case, patient with really poor vision can't recognize. Your partner, of course, will see your hand, the ophthalmoscope, and the answer will be true, but we will see that if the light is here, of course it's a wrong manipulation.
Doctor.
Now where is the light?
Left.
Okay, and now?
Right.
Okay.
But doctor, he sees your hand going like this or like
we
this.
just simulate the situation.
Okay.
You want
to
remove his visual. We simulate. You should know and train the technique. If there will be such real persons will come, I'll bring them to you. But now you just simulate. Of course, he can see, but the real patient can't see. With a very poor vision, can't see and real patient can see only light and direction of light. Okay, if all the answers will be correct, conclusion should be patient has normal or correct light projection. If there will be even one mistake, wrong light projection. Yeah. So it was test number 13.